Okay. Good afternoon to all of you. This is Dr. Vijay here from BCRC. I will be talking about dengue, clinical features, diagnosis, and management. Actually, this class was supposed to be taken last month due to some connectivity problem. Did not happen. Anyway, no problem. Today we will discuss this topic. So, as we know, dengue is a mosquito-borne viral infection. It is a prevalent disease in tropical and subtropical regions of the world. Mostly, it is an urban disease. It's a viral disease. It is caused by the dengue virus, and it belongs to the flavivirus. And there are 4 serotypes known: serotype 1, 2, 3, and 4. And one person can be infected 4 times. Severe dengue is a leading cause of serious illness and death in some of the Asian and Latin American countries, and that is in the tropical region. And the majority of the dengue infections are asymptomatic, and they present with fever and body ache. It is like a flu-like illness, but occasionally it may develop into very severe illness. It is called as 2 types of manifestations are known. One is dengue hemorrhagic fever, and another one is dengue shock syndrome. Am I audible? Hello?
Audible, sir.
If you have any doubt or you can interrupt in between. If there is anything, please let me know. Now, what are the problem with dengue? As we know, many of the virus infections, especially acute virus infection, we do not have any specific treatment, which is true for dengue as well. There is no specific treatment available. But we have very good supportive care. If we provide enough supportive care, most of the patients will recover. And mortality rate, if you give appropriate supportive care, mortality rate is less than 1%. And what are the public health implications of this dengue illness? Recently, if you see, there is dramatic increase in dengue incidence. Even in the Orissa state also, if you see, previously major problem was malaria. Now dengue is increasingly being detected there also. And also mostly previously it was an urban disease. Now it is being detected even in semi-urban and also in rural areas. And as I told earlier, there is no effective treatment. Prevention assumes a very important role for a disease when there is no effective treatment available. And the prevention and control measures depends greatly on effective vector control measures. And obviously vector control measures would require involvement from the community, and sustained community involvement is a necessary thing. Now, to a few words about the dengue virology of the dengue virus and various serotypes. As I mentioned earlier, it is an RNA virus of the family Flaviviridae and the genus Flavivirus. The other important, this one is the West Nile virus, yellow fever virus, and the recently emerging, like in the Zika virus, which was recently detected in Trivandrum, was an outbreak, which is now being detected in other parts of India as well. So Japanese encephalitis, tick-borne encephalitis, Casinosporus disease, Omsk hemorrhagic fever virus, these are all one group of flavivirus. And the dengue virus genome, it is 11,000 nucleotide length, code for 3 different type of protein molecules: C, PRM, and envelope. There are 7 other non-structural protein molecules: NS1, NS2A, NS2B, NS3, NS4A, 4B, and NS5. If you remember that these are some basic knowledge is important for clinical management as well. When you come to diagnosis, you might have heard that we look for NS1 antigen ELISA. Rapid test kits are also available where you look for NS1 antigen. Now, 5 serotypes are known. Out of that, 1, 2, 3, 4 are very prevalent, and the 5th one is also detected in Malaysia, but it has not spread outside Malaysia. So generally, we consider it as 4 different serotypes. So one person can one infection by one particular serotype leads to lifelong immunity. That is our current understanding. But the person might be susceptible with other serotypes, that he can get infected with dengue 2, 3, 4. Now, coming to the epidemiology of the illness, geographical distribution, this is a very recent data, very recent data. You can see that the disease is prevalent in the tropical region. You can see that it's in the Southeast Asian region, this region, and then again in the same belt, this region, South American region, especially Central American and South American region. And also there might be quite a number of cases happening in Africa also, but you can see that Africa is not represented here. May not be that these cases are not happening, so most likely that the cases are being underreported from that area. That might be the reason. There is also some concept that the people of black race are also, there is some protection against dengue. That may be also one reason, but without having solid data, we cannot say this one. But it being a tropical disease, if it is prevalent in South America and Central America and in the Southeast Asian countries, definitely it should, this tropical belt, it should be prevalent in this region as well. Most likely without, most of the African countries are underdeveloped and they may not be reporting the cases probably that way. Now coming to the clinical features of the illness. So like common viral syndrome, typical dengue fever presents with high-grade fever, sudden onset of fever, severe headache, nausea, vomiting may happen, and severe myalgia may happen, retroorbital pain, that is very classical of dengue, then joint pain, especially large joints, and then the rash also may happen. So it is a typical dengue picture, and it may mimic many other illnesses. It may mimic COVID, chikungunya, and the other rhinovirus infection and the other common virus infections. So it may not be so easy to differentiate. One should have a high index of suspicion, especially during the seasonal. Since it is a seasonal illness, vector breeding happened during monsoon. Clinician should have a high index of suspicion. Then he can suspect and then look for the required test. So commonly it is the disease is also called as breakbone fever. Also it is called a 7-day fever. So generally typical duration of the illness is 2 to 7 days. The people will recover within a week. And this severe muscle, joint pain, bone pain, pain behind the eyes, retroorbital pain, nausea, vomiting, rash, these are the common manifestation. And as I told earlier, this may mimic other illness. Typically, it may mimic with chikungunya. How do you differentiate from chikungunya? Chikungunya generally causes small joint involved. Small joints are affected in chikungunya, but in dengue, it is mostly larger joints. And the chikungunya may cause actually arthritis. In dengue, it may be more, arthritis may not be common, it may be more of arthralgia, and the swelling of the joints may not be seen. This is a general presentation of. Then coming to severe dengue, WHO has a classification in 1997 that classified dengue into 3 different, based on clinical presentation, 3 different scenarios are there. One is a dengue fever, classical dengue fever. One is a dengue hemorrhagic fever, and dengue shock syndrome. Now, 2009, WHO has further revised the classification, and they have described the severe dengue as well. Then about 1 in 20 people who get sick with dengue may develop a severe dengue. Severe dengue can result in shock, internal bleeding, and even death. The infants and pregnant women are at higher risk of developing severe dengue. What are the warning signs of severe dengue? Abdominal pain, tenderness in the right hypochondrial region, means the right upper quadrant of the abdomen. Press there if there is pain. That may indicate that that is considered as one of the warning signs for impending severe dengue. Then vomiting, that is not 1 or 2 episodes of vomiting, persistent vomiting should be there. And then bleeding manifestation, bleeding from the nose or from the oral cavity, that is from the gums. Then or blood in the vomitus or blood in the stool. Then very severe tiredness, restless, or the patient is irritable. If these manifestations are there, we have to consider that a patient may be going on developing severe dengue. So, coming to the pathogenesis, how does infection lead to clinical manifestations? Or as I told earlier, majority of the dengue infections go unrecognized. They are asymptomatic. Even if you take the scenario of COVID infection, COVID also majority of the COVID infection are asymptomatic. Only a less number of cases develop severe infection, severe manifestations. Clinical manifestation range from mild flu-like syndrome to the most serious manifestations like dengue hemorrhagic fever and dengue shock syndrome. Dengue fever is a self-limiting. Dengue fever is self-limiting. Incubation period is 3 to 15 days, and the clinical manifestation I told earlier, it is like a viral syndrome, fever, arthralgia, bone pain, ache, muscle pain, then leukopenia if you do blood investigation, myalgia. Myalgia means pain in the muscles. Then retroorbital pain and then skin pressure. Sudden onset of fever, severe headache, and then pain behind the eyes. That is a technical term is retroorbital pain. This if in any patient, especially in people residing in endemic area, fever happening after the onset of monsoon, you have to think of this one. Then, as I mentioned earlier, dengue fever is also known as 7-day fever because of its persistence for a week, and it's also called as breakbone fever. Why it is called breakbone fever is because of the very severe arthralgia, myalgia, and bone pain associated with this. The patient may not be able to walk, he may be bedridden, he may not be able to use limbs. Then there is another thing. As I told, dengue has 4 serotypes: serotype 1, 2, 3, and 4. Then, since 4 different serotypes are there, and theoretically one person can get infected 4 times. When a person, when he gets first time infection, it is called primary dengue infection. So a person who have developed a primary infection in the past with any one of the serotype, if that person again get a second time getting infected, then it is called a secondary infection. And the people have studied this disease in detail, and some observation which came up is that people who develop a secondary infection used to get a severe disease. That is called as, that may be the say it's not yet well confirmed, but it is believed that it is due to a phenomenon called antibody dependent enhancement. In short, it is called as ADE. What happens is that the primary dengue infection results in development of lot of non-neutralizing antibodies. And when a person infected with one particular serotype, these antibodies will persist. And if a person is staying in the endemic area, if he gets infected with another serotype, another strain of the virus, already existing non-neutralizing antibodies will bind to the virus, and these antibodies bind to the virus will attach to the FC receptor on the disease, and that will lead to increased uptake of the virus and increased viremia, and that will lead to very severe infection. That is like most of the cases which we see as severe dengue mostly may be due to secondary infection. Secondary dengue. So some of the patients may develop into shock syndrome, dengue shock syndrome. That is the most serious manifestation. How does it manifest? It manifests with the circulatory failure. There will be tachycardia, hypotension, and the extremities will be cold, clammy extremities will be there. And if you do not interfere right time with the appropriate management of the fluid, profound shock will result at a certain mortality range. Now we move on to, as I mentioned earlier, two different classifications are known. The earliest classification by WHO, that is called 1997 classification. Many of the clinicians still follow this classification, but many do not follow this one. Many of them follow 2009 classification. So if this classification, dengue virus infection is classified into 2 types. One is asymptomatic or symptomatic. Symptomatic is again classified into undifferentiated fever. That is like any other viral syndrome. Do not even consider that it may be dengue infection. I say simply it may be a virus infection. Second is a dengue fever syndrome. Dengue fever syndrome is the classical dengue fever where there is picture presence with fever, severe headache, retroorbital pain, body pain, ache, joint pain, rash, typical dengue manifestation. Then dengue hemorrhagic fever, and it is without hemorrhage and with unusual hemorrhage, and with shock and without shock. Dengue hemorrhagic fever means the plasma leakage will be there, bleeding manifestations will be there, bleeding may be from the nose, maybe in the oral cavity or mucosal surfaces. There may be skin bleeding, skin purpuric spots you can see. And if hemodynamic compromise is there, we call it as a dengue syndrome. Now, 2009 revised dengue case classification. Why WHO revised this dengue classification? Yeah, what is antibody dependent enhancement? I just mentioned antibody dependent enhancement. What is it? Or else leave it. It is a little difficult question. I may ask, what are the different serotype of dengue?
Sir, that is then 1, then 2, then 3, then 4. That 4, 5 type of dengue then virus is there, sir.
Very good. Who is this?
Sir?
Who is this? You are from?
Smriti Ranjan Raut, VVDC Khurda.
Very
So
good.
what is you are asking about antibody dependent, sir? Means if for infection of E serotype, protection is there for lifelong protection is there. But if the infection is again reinfection is done from another serotype, then it will be immunocomplex type of reaction will be there.
Very good, sir. Very good. One more thing is that what is NS1 antigen? I just mentioned about NS1 protein. What is it? What it will be useful for?
Sir, NS1 protein is there, sir. Sir, the virus, the viral membrane is made up of 6 non-structural proteins. NS1, NS2, NS2A, NS2B, NS3A, NS3B. In this way, 6 type of non-structural protein is there. So what we are doing in NS1 is the MAC NS1 we are detecting. Means that non-structural protein is we are detecting in NS1 ELISA test.
Okay. Okay. Very good, sir. Very good. Thank you. Now we move on to the again next slide. So here again, WHO felt that many people working in the field of dengue virus, dengue disease, they felt that there should be a revised classification. Why this is required was that many of the clinicians felt that they need some kind of a marker or some kind of signs or symptoms which may be useful in predicting like which person is going to develop dengue hemorrhagic fever or dengue shock syndrome. Means that they want to differentiate or predict mild infection from severe infection or who is going to develop a severe infection. So this resulted into better manage or triage the patients. Some people proposed another classification system, and WHO have come up with the revised dengue case classification. In that one major thing is that define dengue into dengue with or without warning signs and identification of severe dengue. So severe plasma leakage, severe hemorrhage, severe organ impairment, this will be classified as severe dengue. And those another thing is that dengue with or without warning signs. So warning signs I just mentioned in the earlier part of the lecture. So what are the warning signs? Abdominal pain or tenderness, persistent vomiting, clinical fluid accumulation, mucosal bleed, lethargy and restlessness, liver enlargement more than 2 cm, laboratory evidence increase in hematocrit concurrent with rapid decrease in platelet count. These features indicate that a person is likely to develop severe dengue. So then another thing is called, there is something else called expanded dengue syndrome. In of late, what's the dengue manifestation? Clinicians say that they see many cases, they see disproportionate involvement of one particular organ. Meaning certain cases of dengue infection, liver failure may happen. AST or ALT will be very high, more than 1000. In some cases, CNS impaired consciousness is the central nervous system is affected. Certain cases, myocarditis is there, cardiovascular system or heart is affected. So those cases, severe isolated organ involvement are seen. They are called as expanded dengue syndrome. Now there is something called probable dengue also. Probable dengue means that a fever, like when you suspect a person is likely to have dengue infection, that is the typical manifestation, like fever, traveling to an endemic area, fever and 2 of the criteria, nausea, vomiting, fever is there, nausea or vomiting, rash, aches and pains, tourniquet test positive, leukopenia, what is the tourniquet test? Can anyone say what is tourniquet test or HES test?
Sir, in the forearm, sir, in the forearm region or feci region, we tied a tape or something, so that if hemorrhagic is occurring beneath the skin, it can be visible.
Okay. Okay, sir. I am actually here. I am taking means our students. We have masters of public health entomology students. So they are also joining this class from here. I may ask one of the students also. One student has sent. Who was the assignment? Here is Pavitra here. She will tell what is a HES test. Yes, ma'am. You can explain what Karan has told, please. Pavitra. How do you
I
do
think
that?
audio is low, sir.
Can you come here and actually she is at a little bit distance. She is coming here in the front. Please come. Please. No problem. Please come here. That's okay. Even if it is wrong, no problem. So Pavitra is going to explain what is a HES test. Yes, Pavitra. Because that would be a useful test in a scenario, especially in peripheral centers where we do not have immediate availability of laboratory test. Yeah.
The purpose of this test is to access the register. Perform the test, the pressure is happening with the blood pressure curve inflated between systolic and diastolic pressure for 10 minutes. And after removing the curve, the number of shear in an 5 centimeter diameter circle of an area under the pressure is counted. Normally, it will be less than 15 or seen. This test, it is also called as rampability test.
Okay, thank you, Pavitra. So, HES test may be a useful test in a when you suspect dengue infection that indicates capillary fragility. Now we talk a little bit about the vectors of dengue. I have just mentioned that the Aedes aegypti and albopictus are the two vectors. So primary vector is Aedes aegypti and the Aedes albopictus also known to spread this one. Experimental conditions, some other Aedes species are
Sir, excuse me, sir. Sorry to interrupt you. Your voice is not clear, very low audible. Please increase your volume, sir. Otherwise, we are not getting anything from you.
Okay, okay. Thank you. Thank you for the feedback. We will do. Is that it? This one? Huh? Speaker is there, not speaking. No speaker problem. Am I audible now?
Audible, sir, but voice is very low, sir. I think the volume, please put rise or something.
Just 1 second.
So I think the system audio or any headphones, which one you will be using, sir? Headphone or? System.
That volume, that second one, that one, next one, that we increase it. Is it audible now? Hello?
Oh, audible, sir. No issue.
Oh. Okay. So now we are coming to the vector part. So as I mentioned, the Aedes aegypti is the primary vector. In certain regions, Aedes albopictus, especially in Kerala, it has been detected in albopictus. This is a diagrammatic representation that how this human beings are getting infection, period of illness, incubation period. So when the mosquito infects the patient after bite, then incubation period of 3 to 8 days, fever onset in the patient, and this duration of the illness is usually 2 to 8 days, and there will be patient will recover. And as I told earlier, there are 4 serotypes: dengue 1, 2, 3, and 4. So one person is theoretically he may get infected with 4 times. Now coming to the diagnosis part, I just mentioned about NS1. How do you diagnose a dengue infection? So primarily, first you have to suspect that a patient presenting with a fever, joint pain, clinical manifestation, especially in endemic area, or who have recently traveled to the endemic area, coming back complaining of fever with body ache, headache, retroorbital pain, rash, bleeding manifestation. Then you have to think that this person may be suffering from dengue. So in some of the tests are advanced tests, some cannot be done in peripheral setting. Some of the tests can be done in peripheral setting itself. So simple test, what you can do is that the supportive test is that you go for a hemogram. So in hemogram, what manifestation? Thrombocytopenia may be there, leukopenia will be there, leukopenia and thrombocytopenia. In a patient with fever where you suspect dengue, if there is thrombocytopenia and also leukopenia, this may indicate that most likely he may be but does not necessarily mean that the patient is suffering from dengue, because many of the viral syndromes are known to cause thrombocytopenia. Then other test that is available is a useful test is NS1 antigen ELISA that may be done with an ELISA machine available, means that can be done in Taluk hospital or district hospital. That may be possible to do this one. Then rapid test cards are available looking for NS1, but there are problem with using rapid card test because the sensitivity is not so good. It means that if a person, you say that if his NS1 antigen is positive, he may be suffering from dengue. But if it is negative, we cannot say that it is not dengue. There is a problem. We have to go for other tests. And then also diagnostic method depends a lot on what stage of the illness the patient is presenting. So if initial days, if the patient is presenting within 3 to 5 days of onset of fever, especially within 3 days, at that time you can use NS1 antigen ELISA. But if the patient is presenting that time, in serological test IgM ELISA may not be a useful test. If the patient is presenting within 3 days of onset of fever, you have to go for NS1 antigen ELISA. IgM test may not be useful. But if the patient is presenting 3 to 5 days after onset of fever, in that case, you can go for both the tests. NS1 antigen test also will be useful, and IgM ELISA also can be used. And then in some cases, you can go for IgG test also if you want to differentiate between whether it is a primary dengue or whether it is a secondary dengue. In secondary dengue infections, when you go for serum IgG test, it will be positive. In primary dengue infection, person is developing infection for the first time. So if you do IgG test in the initial 5 days, always it will be IgG will be negative. So in a patient with dengue, if IgG is negative, NS1 antigen is positive, IgM is positive, that means that he might be most likely suffering from primary infection. And if in a case of a dengue, if you say test within 5 days of onset of fever, if NS1 antigen test is positive, IgM ELISA positive, IgG positive, that indicates that mostly he might be suffering from secondary dengue. There are other tests are also available. Avidity test is also available. Then also you can use for IgM, IgG ratio as well. Those tests also may be useful in identifying or predicting whether the person is suffering from primary dengue or secondary dengue. Why do we want to identify that one? Because in secondary dengue, we anticipate that the person may develop a severe disease. Now, other tests or more sensitive tests we will go for, like in COVID testing. Now everybody is familiar with using real-time PCR, real-time RT-PCR. So same test can be used. This is also again an RNA virus or reverse transcriptase real-time PCR tests are available. So you can go for molecular test for dengue infection as well. So just to summarize, a simple test one is like a simple supportive laboratory test that can be done is one is hemogram, which would show leukopenia or it may show thrombocytopenia. Then one more thing we can for is that hematocrit, that is PCB can be seen. So hematocrit will be, if the person is going in for a dengue shock syndrome, hematocrit maybe normal will be somewhere between 35 to 40. But if a person with the suspected dengue fever, if the hematocrit is more than 40, suppose you see if it is 50 or 60, and then after we give appropriate fluid therapy, and if the hematocrit is coming down from 60, it is coming down to 50 or normalizing to 40, more or less it indicates that the person has developed severe dengue and the chemo concentration is there. That is also a definitive method of diagnosis of dengue. Now, serological methods I just mentioned, that is enzyme linked immunosorbent assay. which you can detect the NS1 antigen, or also you can detect IgG, IgM, and IgG. IgG may not be useful in a acute setting. It may not be useful, but it may be useful in identifying whether it is a primary dengue or secondary dengue. Virus culture, you can do it, but those all require advanced setting and advanced facilities are required that may not be useful in a clinical setting. Then coming to one more aspect, that is about the dengue transmission cycle. So dengue virus originated from an animal reservoir. Two distinct dengue transmission cycles are recognized. One is endemic or epidemic cycle, and second one is sylvatic or zoonotic cycle. Endemic and epidemic cycle involve the human host and virus are transmitted by the mosquitoes. Sylvatic transmission cycle involves monkeys and several different Aedes mosquitoes are there in Asia and West Africa. Coming to the treatment or management of the condition, as I told, there is no specific treatment for dengue fever. Fever reduces, painkillers can be used. Here you have to remember one thing. NSAIDs such as ibuprofen and aspirin should be avoided. So in any patient, when you suspect dengue fever, these drugs, NSAIDs and should be avoided. Aspirin should be avoided. Here is one mismanagement usually happen in fever patients. Like many of our patients, initially when they have fever, they would not consult a physician. What they would do is that they will go for over-the-counter medicines. So they will go to the pharmacy. The pharmacist will give sometimes ibuprofen or diclofenac. So they will give some potent NSAID or aspirin, and the patient may develop it. Since this dengue fever is associated with bleeding manifestations and clotting manifestations, these NSAIDs are known to interfere with the clotting and bleeding mechanism, and that may lead to severe disease. So unless we rule out dengue infection, we should not give NSAIDs, or this can be given only in a supervised setting. Even if patient is developing any bleeding manifestation, immediately it can be detected, appropriate treatment can be given. So this always one should remember that when you suspect dengue fever, please avoid giving non-steroidal anti-inflammatories. And then if the patient is important thing is that we have to identify the patient early enough. That is where these warning signs would be useful. Any patient that warning signs are present means better keep him under observation. And then we monitor him for the platelet count. We can monitor. Then also another thing is, as I mentioned, hematocrit. Hematocrit can be closely monitored. That both these tests can be done even in peripheral setting. And blood pressure and the other hemodynamic parameter need to be closely monitored. So if the patient is showing initially, if it is not a severe illness, it can be managed with oral fluids. They are selling something. Yeah. So when we think of patient, trick is to identify the patient early enough that who is going to develop a complication. So as I mentioned earlier, we have to look for warning signs. If any patient with warning signs, he need to be under observation closely. We need to observe or look for platelet count, look for hematocrit. If it shows any hemo concentration, we have to start a fluid therapy. So mild to moderate cases, we can give oral fluid therapy. That is either ORS can be used, or otherwise we can give like we manage diarrhea, like lime water with salt and sugar. Better is ORS. ORS can be given, or otherwise it can be managed with oral fluid therapy. Then we have to manage the fever body ache with the paracetamol, and then NSAID should be avoided. And second important thing is that suppose if he develops a severe hemodynamic compromise, or he is not improving with the hemo concentration is persisting despite oral fluid therapy, in that case he may require fluid therapy. And depending upon the severity of the condition, if there is hemodynamic compromise or not, or simply hemo concentration is there, accordingly we have to titrate the fluid therapy. So if patient is presenting with a severe profound shock, means that we have to give IV fluid bolus, that initially 20 ml per kg, 3 boluses needs to be given. And still, if he is not improving, we have to start on dopamine, that inotropic agents needs to be started. And also in all cases of dengue, we need to rule out the septic shock also. Sometimes it may be very difficult to differentiate between dengue shock as well and from septic shock. So anticipating this one, we may have to think of empirical treatment as well. Then another important thing is that once we start this fluid therapy, after this is a transient leakage happening from the intravascular compartment to the extravascular compartment. So fluid, once that fluid which has moved out into the extravascular compartment, after some point of time it may come back again into the intravascular compartment. So if we give too much fluid also, that may be also problematic. So nowadays it is identified that fluid therapy, if not done properly, may actually worsen the condition. So one has to be very watchful and appropriate, and this fluid management that need to be done. And sometimes it may require, most often it may require intensive care management, and the volume need to be titrated very. Now, what about the prevention? That is about the treatment or management of the condition. Vaccination. So what are the dengue vaccine? Now a tetravalent vaccine is available. Dengue vaccine is available. It is licensed in a few countries, also around 20 countries. And then what are the problem with giving dengue vaccine? Anybody tell what is the problem with the dengue vaccine? Sanofi person has marketing dengue vaccine. Do you take, suppose if somebody is staying in endemic area, somebody is coming to you and ask that dengue vaccine is now available. So I want to take dengue vaccine. What would be your advice?
Sir, it is less than 50% effective, sir. And sir, it is only recommended for adult, I think.
Okay. Even if it is recommended, what is the necessity? How do you advise that one? Suppose if somebody is coming and ask you, sir, I want to know whether I need to take dengue vaccine or not. What is your advice? What you will advise to that person?
Sir, not audible, sir. Again, sir, please.
Person, somebody is coming, like you are staying in an endemic area, somebody is coming to you and asking that you are working in NBBDCP, I want to know, you might be dealing with the dengue patients, I have some doubt, I want to take dengue vaccine. What is your advice? Somebody is asking you, what advice you would give?
Sir, it's not approved in India, sir.
Approval is okay. It is available. Assume that it is available. He is telling like that he can get from outside. He want to take personally some treatment. Okay. It's okay. It's available. You assume like that. It's available. Everything is this one. How do you advise that person?
And the problem is the same, sir. That the 5 serotypes is there, na?
Yes, 5 serotypes are there. So what is the
So
problem?
it's not effective for all.
No, it is a tetravalent. Na? It's tetravalent. 5 is present very few, means very less places only. Na? Leave about 5. 4 are there. So assume that 4 it is a tetravalent vaccine. It contains all the viruses. What is the problem? Somebody is coming to ask me, sir, I am staying in endemic area. I am very much worried about dengue. I want to take this dengue vaccine. What do you advise? So what I would do is I would ask some of the students here, that is here, Dharani, let her answer that question. Dharani, please come here and please, what's your opinion about dengue vaccination? Somebody wants.
Sir,
Yeah.
hello?
Yeah, yes.
Sir, it is, sir, recommended for adults, sir, only, sir. In children, sir, what is it is doing? It is, sir, it is creating some side effect which is similar to hemorrhagic, sir.
Yeah.
Similar symptom to dengue hemorrhagic, sir. That's why, sir, it is only approved in 13 countries, sir, not in India.
Yeah, okay. If it is approved in 13 countries, simply people won't approve. Now, there might be some use. Otherwise, why they approve?
Sir, the problem is there. Sir, problem is that it's not recommended for children, sir.
Okay, why it is not recommended to children? What is the problem?
So because, sir, it is, sir, creating, sir, sir, that side effect is coming as it is coming in dengue hemorrhagic, sir. That is bleeding in in different organs in children. It's creating hemorrhagic, sir. As a side effect.
Why then they approved in 13 countries? If such a problem.
Sir, why they have approved, sir? I don't know. So this is because, sir, in most of the countries where it is approved, that is it is highly endemic for dengue, and all the serotypes are prevalent there. I think, and it's the only vaccine that is available.
Okay.
And it is less than 50% effective, and it is not effective in all serotypes.
Okay. Thank you for your this one. Let us ask someone else also. Here, some students are here. One student is a Dharani. Let us ask your opinion as well. Dharani, please. What's your idea regarding dengue vaccination? Please come here and please explain. Suppose a person, I am repeating the question, a person from endemic area, he is coming and asking you, madam, I want to know whether I should take dengue vaccine or not. You please advise that person.
check if they are already infected. We have to check if he is already infected or not. If he is not infected, we should not give the vaccine. If he is already infected with any of these, we can give the vaccine. For the uninfected person, due to the antibody dependent, they should not wish to take vaccine.
Do you agree, sir? Are you? Is she audible? Did you listen to her? Hello. Hello.
Sir, not audible at all, sir. What she said.
Repeat, please, from here. This one. Please.
First, we have to ask them whether they are infected with dengue or not. If they are already infected with any of the serotypes, we can advise them to take the vaccine. In case if they are not infected, we should not advise them because of the antibody dependent enhancement. They should not take the vaccine.
So that is why that the phenomenon of antibody dependent enhancement is important. So that's why that Sanofi Pasteur, what they are trying to do is that they wanted to develop a test that before advising any person on dengue vaccination, they want to see that whether the person has already been infected. If a person is already been infected with the dengue, he may be offered a vaccine, this one. But if a person is not at all infected with dengue, what would happen is that he will be given with 4 vaccine strains from the vaccine, and that would be like a primary infection. And if the person when he is staying in the endemic area is at a risk of getting exposed to all the 4 strains of virus, and if he gets infection with a wild strain, he may develop a very severe dengue. This is seen mainly in children. That's why problem with the dengue vaccination. So people are trying to solve that problem. So what the recommendation is that if there is more than 80% endemicity in a region or in a country, those regions only this vaccine may be advisable. Otherwise, it may not be, public vaccination may not be useful, or it may cause more problems. That's about vaccination. And now coming to the prevention. As I mentioned earlier, since we do not have an effective or safe vaccine, prevention depending upon avoidance of man-mosquito contact and avoidance also man-mosquito contact. You can use mosquito nets may not be very useful because this is Aedes aegypti, usually bites in the daytime. This one, obviously, use of net may not be very useful. However, other vector control measures like integrated vector management may be useful. That larvicidal measures and other measures generally applicable to other virus infections, Aedes aegypti, it may be useful. So open collection, so what are the environmental modification is the preferred method of control, and prevent mosquito bites by wearing clothing that fully covers the skin, mosquito netting while resting, and also application of insect repellent.